How to get rid of excess weight. In Turkey, such treatment is put on stream. This is one of the most popular directions of medical assistance for foreigners. Individuals with extreme weight experience significantly elevated risks of life-threatening comorbidities, such as metabolic disorders, diabetes, joint destruction, and heart diseases. The most effective way to get rid of obesity is to seek the help of a surgeon. Bariatric surgery is a special class of operations on the gastrointestinal tract. In the big video at the link on screen, we've reviewed the most common types of operations. In this video, a well-known expert in bariatric medicine in Antalya, Turkey, Dr. Mehmet Norikashar, provides detailed information about one type of surgery, gastric sleeve resection. We have videos on similar operation types and more. What is this procedure? Drain the gastrectomy. Sleeve gastrectomy. This is a laparoscopic surgical operation that is currently ranked first in the world in terms of demand. We take pictures using a laparoscopic system. The patient is lying on the operating table. The operating table is unique because it is designed to transport individuals with a substantial weight. If you inquire about the maximum weight of a patient who has undergone surgery, I once had a patient who weighed 320 kilograms. So, the patient is lying on the table. Stomach reduction operations are performed using a camera that is inserted through an incision above the navel. The doctor has a clear view of everything. This is referred to as the initial step. Then the patient undergoes 4 additional small incisions, each approximately 1 or half a centimeter in size, which are known as trocars. The abdominal cavity is inflated with carbon dioxide gas. Later, after the veins that are connected to a large part of the stomach are cut, there are no connections left. What we do within the gastrointestinal tract, we manage with the assistance of an additional camera, an orogastric probe, which is ingested by the patient. Typically, we initiate work using these tools referred to as step tours and strive to achieve a smoother stomach and create a seamless line in order to enhance the overall appearance. Next, it is necessary to anatomically give the stomach the shape of a banana. Here comes the first phase, which is referred to as the intrangular phase. The stomach possesses a broad back, and we must not make it narrower. Both the front and back sections of the stomach ought to be cut in equal proportions. Otherwise, there may be complications that can arise in the future. These can range from stomach upset and nausea to the formation of adhesions, as well as the possibility of leakage from the stomach after undergoing surgery. Technically, all actions appear to be simple, but it is important that the operation is carried out by experienced and competent surgeons. During sleeve resection using gastrectomy, we examine all sections of the esophagus and stomach. Removes approximately 70 to 80% of the stomach. This is a spare part that produces the hormone ghrelin, and we refer to it as the hunger hormone. We extract the distant tissues via a 12mm hole. The remaining capacity of the stomach is roughly around 200 to 250 milliliters. After the operation, together with dietitians, we give the patient a brochure about his new diet, nutrition program. So, the majority of the stomach is removed, while the remaining portion continues to function. This is a surgical technique that limits nutritional intake but does not hinder the absorption of nutrients. This is a gastrectomy with sleeve resection of the stomach. When the area of the stomach or intestines contracts, hunger sensations decrease. A person simply does not want to eat more than the reduced gastrointestinal tract allows. Less food enters the body, extra kilograms go away. Of course, despite the lack of appetite, a person may want to eat something out of habit at first. Therefore, the effective treatment depends on self-control. The patient is prescribed a diet. The main thing is that the impact of such operations lasts long. What is the usual duration of the operation? How long does the patient typically need to stay in the hospital after the operation? And when can the patient usually return home or to their hotel? If we talk about the operation of gastric bypass, sleeve gastrectomy, then these are operations that last half an hour to an hour. Usually we hospitalize our patients for 2 nights after the surgery. In other words, we accommodate both our local and foreign patients for 2 nights. After the second night, usually in the morning of the 3rd day, if everything is fine after taking water, juice, and soup and receiving dietary instructions from us, patients go to the hotel. If they have a home, we send them home. And if they come from abroad, we let them go home after 10-12 days. There is no harm in traveling by airplane. How quickly does the patient begin to notice the effect of the surgical operation? When does weight loss occur? gastric bypass, sleeve resection has been performed for many years, and it has been scientifically proven that the operation leads to weight loss. For the first 10 days, this operation leads to a loss of almost 10 kilograms. Then the slowing down of the effect begins. The rate of weight loss is diminishing. Scientific research demonstrates that 40 to 60% of individuals with obesity continue to experience weight loss during the first 6 months, according to studies. The effect of this operation lasts up to 1.5 years, approximately 18 months, depending on age, gender, and metabolic status. If the average weight for a person is around 60 kilos and he weighed 150 kilo, then it will take 1.5 years to reach the normal weight of 60 kilo. Approximately 60% of excess weight is lost in the first 6 months. At this time, rapid weight loss is occurring. During this time, it may be necessary to take vitamin supplements. Whether you engage in more or fewer physical activities, they will assist you in losing weight in all situations and maintaining proximity to your desired weight. Every person is unique. There is no such concept as standard weight. Everyone has their own parameters. Every person is unique. Once you reach a normal weight, everything else depends on you. The first 1.5 years is a critical period when you can improve your habits, reduce food intake, engage in sports activities to make positive changes. If you do this, your regular weight will be maintained for the duration of your life. The video description includes procedure cost, reception, airport pickup, hotel accommodation, and assistance of a language-speaking assistant. Turkey differentiates itself from other countries with its comprehensive approach to patient care, in which each procedure must be paid for individually. The company Healthy Turkiye, which exclusively works with verified specialists in both medicine and hospitality, is responsible for organizing such an all-inclusive trip and coordinates all of their work for each patient. Healthy Turkiye takes care of everything, from consultation agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents, and even rest between doctor's appointments. The company's website address is on the screen. There is a lot of information about other directions of health tourism. You can use it as a reference material. Feel free to contact this number for consultation. Don't forget to subscribe to our channel and don't miss new videos about medical tourism in Turkey.